Doctors across the country are calling on the government to make it easier for them to treat patients across different provinces and territories. So as of 2024, more than 1 in 5 Canadians does not have a family doctor, 1 in 5. And now the Canadian Medical Association is asking lawmakers to update the system that licenses doctors as a way to address shortages facing our healthcare system. For more on what doctors are hoping for and how this could affect you, the patient, we are joined by Dr. Joss Reimer, president of the Canadian Medical Association. Good morning to you, doctor.
Thanks for having me.
So what are the current provincial barriers? What's in place right now?
Well, unlike how it works for most Canadians, where we have the right to move around the country and work anywhere that we want to live in this country, for doctors, because healthcare is regulated provincially, that means that we have to be licensed in any province or territory that we want to work in. And that means filling out a lot of paperwork and paying thousands of dollars to be able to work in that province. And for the most part, if you're going to stay in that one province and not do anything anywhere else, that might be okay. But when we're seeing all of these ER closures, we're seeing the levels of burnout amongst doctors going up, we really need more flexibility and the ability for doctors to respond when there's a need in another community.
So the CMA has been lobbying for a pan-Canadian licensure program. What is that?
Well, we're open to many different models, but what we want to see at the end of the day is that physicians can move across the country and respond to needs, so that if there is an emergency room in BC that's closing, like we just saw this past week, that somebody from Toronto could, if they have a free week, go out and fill in and make sure that emergency room stays open. So whether we have a national license that everybody gets to sign up for, or we just have recognition of our licenses from one province to the other, that's really what we want to see. And we have an example from the Atlantic provinces. There, you can pay $500, and as long as you have a license in one of the 4 provinces there, you can work in any of those 4. And so that's something that we want to learn from and see if a model like that would make sense for the rest of the country.
Let's talk about rural areas, because they struggle the most with doctor shortages. So even if there was a pan-Canadian license, let's say, there needs to be incentive, of course, for doctors to move to these rural areas. How would this program address that, and would it?
Well, there's no question that rural and remote areas struggle the most to get appropriate health care, and it's hard to convince doctors to move to those areas. We certainly want to recruit from those areas, because if you're from a rural or remote area, you're much more likely to go back there after your training. But we also recognize that we need to have some of those temporary, or what we call locum positions, where you come, you spend a week at a time or other periods of time, but you don't actually live there. And that's where this approach can be really helpful, because somebody who's living in Calgary might be willing to go to northern Manitoba for 1 week every couple of months. But if they have to pay thousands of dollars and go through that paperwork, that might not be worth it for them. But if their license was just recognized and it meant going out and helping for a week at a time, they might be open to doing that. And that's the type of flexibility we want to see for rural and remote areas who really struggle to get the doctors who are going to come and stay and work. And even when you have a doctor who lives in that community, oftentimes they're the only one and they need time off. They need to have breaks, because when you're the only doctor, you're 24/7. And so having that ability to have that same Calgary doctor come and cover a vacation for someone in northern Manitoba can make the difference between whether or not that doctor stays.
I want to go back to something you mentioned, doctor, that, Atlantic Canada has adopted a program for physicians called the Atlantic Registry, right? So in terms of how it is going, how has it been going so far?
Well, we're hearing positive responses from the doctors who are there. And when we survey doctors, 90% of them support some sort of national approach to how we license our physicians. So we know that this is not a fix-all for the shortage we have. We are short 23,000 family physicians in Canada. This is only one part of that solution. So we know that improving mobility will have a slight improvement, and we need to be doing everything that we can, moving in every direction to make this better for Canadians, because as you said at the beginning, there are so many who don't have access to a family doctor, and that is a big problem.
Dr. Reimer, president of CMA, thanks for your time this morning.
I really appreciate it. Thank you so much.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.